Welcome to Forum 360 on Vision, your PBS affiliate. I am Michael Neumann, your host. We thank you for joining us. Have you ever wanted to take greater control of your mind, body, spirit, and social environment? Have you ever wanted to predict the future by using self-fulfilling prophecies? Well, this program is for you, as there has been a dramatic shift in the American healthcare system towards holistic needs to assure optimal health and healing. Our guest today is no stranger to Forum 360. Dr. Moshe Torem has appeared in several of these programs. Dr. Torem is professor of psychiatry at Northeast Ohio Medical University and has authored numerous articles and book chapters in the field of behavioral science, guided imagery, and mind-body integrative medicine. Dr. Torem, welcome to Forum 360.
Thank you, Michael.
Our program today is going to center on the topic of predicting the future through an approach called Back to the Future.
Back from the future.
Back from the future, even better.
Yes.
Some of the questions I would like to ask initially has to do with verbal communication.
Yes.
Verbal communication, as we know, could either be the past, the present, or the future.
Right.
So I'd like to start by asking you, why is the future so important, and in certain aspects, even more important than either the past or the present?
Yes. That's an excellent question, and there's many ways to address it. I'll start with a quote from Charles Kettering. You know, Charles Kettering was one of the great inventors in the American automobile industry. He actually invented the self-starter. So when we get into a car today, we either turn a key or push a button and the engine starts. Mm-hmm. It wasn't like that before. You know, the Model T Ford, which was the first mass-produced car, was quite popular, but it had one flaw, so to speak. If to start the engine, you had to go to the outside and manually start the engine. Charles Kettering changed that with his original invention of the self-starter. When he was asked about the past, the present, or the future, and he said, quote, "I'm going to focus on the future." And they asked him why, and he said, because I'm going to spend the rest of my time, rest of my life there, unquote. So he recognized, of course, that it is the future that will make all the difference. The other interesting elements is quite a few known psychologists, like Carl Jung, as an example, who had a feud with Freud. Freud focused on the past to understand the present and people's behavior. You have to sort of go into the past and look into people's childhoods and da-da-da and so on. Mm-hmm. Well, Carl Jung said no. It's more important to focus on the future because we are pulled by our expectations of the future, by our dreams of the future, by our desires mm-hmm. of what the future is going to be like for us. And that has much more energy than being pushed by past issues.
So, though a lot of the recent publications are talking about the future as opposed to the present or past,
yes.
I guess the origins then of future predicting and the importance of the future goes back a while, I would assume then.
Oh yes, one of the origins we can actually find in the Bible. A famous quote in the Bible is from the book of Proverbs that says, "Where there is no vision," meaning of the future, "people perish." So the idea of having hope of a better future is, among other things, drove many people to cross the Atlantic Ocean, you know, in in ships, mm-hmm. all right, and during the 19th century and even before that, to a new continent with hope for a new and better life, mm-hmm. as you know, like your own ancestors have done, mm-hmm. and so on. So yes, And the future has driven people to do all kinds of stuff in many ways, inventions, new trips, and so on. Columbus, discovered, so to speak, America because he was driven by a trip to go to India. Meaning, if he goes west enough, since the globe is round, he would get to India. So, and that's why we have the name the West Indies, believing that he got to India when actually he discovered a new continent. Yeah.
So with all your work and studies with patients, etc., how difficult have you found the acceptance of an individual in terms of making the future time the present time? And what are some of the struggles in having people, again, accept the future as the present moment or the present time?
Well, that's an excellent question. I think what may help is some practical examples of that. One would be, for example, when a patient is preparing for surgery, elective surgery. It could be a woman that's preparing for an elective hysterectomy, or a man that's preparing for a prostatectomy, or some other medical procedure, even. It could be a diagnostic procedure. And they have some fears and anxieties and so on. One of the best ways to approach is to say to them, what would be the best possible outcome of this procedure, whether it's surgery or diagnostic procedure?
Planting that seed in your mind.
Yes. And so we talk about that best possible outcome. And obviously it has to be, to some extent, a realistic outcome. So we have a conversation about that, and once we have defined it and agreed upon this best possible outcome, then what I help a person with that is guide them into experiencing the best possible outcome. So let's say if a person has surgery, they are well prepared for it, the doctors have good training and expertise and have had many surgical successful outcomes of that specific procedure. They are taken into the operating room, they're calm, they're relaxed, and then they wake up in the recovery room, becoming alert, awake, and oriented, and within a couple of days, they're discharged from the hospital, and they're back home. And if a person has a job, within so many days or weeks, depending on what's realistic positive expectation, they're back to work, functioning well, feeling much better than before. And we focus on that experience using all the 5 senses: the visual sense, the sense of hearing, the sense of touch, the sense of smell, and the sense of taste. So
all 5 senses are equally important in this process?
Yes, and the one that's the most important, of course, is the one that a particular individual believes, knowing themselves, that is the sense that for them is the most powerful in remembering things and experiencing things.
And that will differ per each person then, you're suggesting?
Absolutely.
Interesting.
But you can also focus on all the other senses. So a good one would be, let's say, having a celebratory meal together with family members and friends, celebrating coming back to work, as an example, after a surgical procedure. And in a meal, you can, of course, you have the visual sense, seeing the faces of the people, friends, family members, and so on, smiling and looking at you with a sense of happiness, seeing you, all right, having recovered from that specific surgical procedure. The auditory, hearing people's voices, hearing their sound of their voice talking to you, saying, I love you, you look wonderful, and so on. As an example, welcome back, and other statements, positive statements like that. We go to the sense of touch, the hug, the kiss with some people, on your cheek and so on, and feeling the hug and the touch. The sense of smell, whether it is perfume or whether it is smelling food that you like, okay? And then the taste, putting the food in your mouth and tasting it well and able to chew it and swallow it. So you see in a meal like that, a celebratory meal, you can have an experience of all 5 senses. And the beautiful of the meal is that when you chew the food and swallow it, you actually internalize metaphorically the whole experience.
So you keep putting these seeds in your mind, which
Absolutely,
affect all of
yes.
the senses.
And remember when I mentioned before, back from the future, then I bring them back from that future to the present. And in their mind, they already experienced the best possible outcome. So in their mind, it already happened.
So if someone was having surgery and they
Yes.
wanted to experience back from the future,
Yes.
and putting these seeds into their mind and hitting all five senses, is there a time duration that it should be done, weeks or months or days before the surgery, or does it depend on the individual?
Well,
Is there
yeah,
an
I wouldn't
optimal
call
time?
them seeds. I would call them rather experiences. Okay, so these are experiences that the exercise called back from the future, from that future that's been experienced already, and back to the present. So this already in their mind has happened. In their mind, it has happened. So now the
So
interesting
they're
element.
convinced that this has already happened in.
Yeah, in their mind. And
Right.
the interesting element when I ask people to, for example, write an essay about their experience or speak about their experience, some of the people spontaneously use a past tense to describe the experience. So they would say, for example, I had one person that wanted to be present at the graduation of her son from high school. And it was very important to her because she was not well, she was struggling with some health issues and so on. And so we did that exercise, and it was like 2 years in advance, all right, the high school graduation. But then when she described in an essay what this experience was like for her, she used the past tense. I saw my son receiving his high school diploma.
Okay.
You follow? And he looked so happy, and he kissed me on the cheek, and I felt his hug. So the person spontaneously uses a past tense to describe a future experience because it's been internalized in their mind like it already has happened.
Right, right. So it's kind of a self-fulfilling prophecy.
Absolutely. Yeah.
Fabulous. I personally have had a lot of trouble on SAT tests and ACT
Yes.
tests, and so has my children. Can this be helping in school? Could it be helping in a business career?
Oh, yes.
Have you
Oh,
seen
yes.
examples of that?
Yes, I've worked with many students that have had clearly good knowledge and good experience knowing the material, and yet when they came to do a multiple choice question exam, due to anxiety or some other reasons, they were not able to finish it on time, and they were not able to retrieve the information to answer the questions, even though they knew the answers, but the anxiety blocked them or slowed them down. They were not able to finish on time, and they couldn't pass the exam. They tried sometimes a second time, they couldn't. So when they worked with me, I was able to use that back from the future technique with them. And the wonderful thing is they did the exam again, passed with flying colors, no problem.
Fabulous.
Yes, job interview, same thing. And preparing, for example, people prepare for an important job interview.
Right.
Same idea. Getting them to be in the interview, everything goes well, smiles are exchanged, there's a nice conversation going on. And again, internalizing it back from the future to the present, and that affects them in such a way that when they go to the actual interview, they're performing at their best.
I'm Michael Neumann, your host today on Forum 360, with our guest, Dr. Moshe Torem, with our topic, Predicting the Future, with a technique called Back from the Future. So Dr. Torem, what type of environment does this technique of Back from the Future work best in? Where have you seen your biggest successes?
In lots of different situations. I have worked with people who wanted to achieve a certain outcome in sports, like people playing golf, people in competitive sport games.
But in terms of a social environment,
terms of a social
a setting,
Yeah. Let's say someone is preparing for an important meeting, a business executive. He or she are chairing a certain committee or a certain group, and they want to achieve a specific outcome. And so one of the elements I have used the Back from the Future technique is exactly in that setting, how well they are prepared, the work that they have done, clarifying the goals, speaking fluently.
But in terms of a setting of a quiet environment where you do this?
Okay,
or,
and yeah, that setting, yes.
Yeah.
Yeah, obviously, working on a one-to-one basis in a room where there are no distractions. So that means no cell phones, buzzing or or ringing, and no television and no radio, and nobody knocks on the door to interrupt. So you have a
Very quiet,
one-to-one quiet environment. And one of the elements is important is to teach the person also to reduce their level of stress and anxiety and achieving a level of calmness, tranquility.
You speak of stress. I just read an article that 70% of people who see general practitioners are seeing them for illnesses that are stress related.
Yes.
And I know we spoke on a show ago about stress, but obviously this technique will help reduce stress as well, obviously.
Oh, absolutely, yes.
Good. You mentioned sports. It was very interesting in the NBA Finals that just ended. Klay Thompson, I guess one of the star guards for the Warriors, had a very bad game. And then 48 hours, he had a very good game. And they asked him what happened. And he said, I put my headphones on and I didn't watch any tape of the previous game. And I just envisioned the perfect release and the perfect toss and the ball swishing through the net. And I had my eyes closed and I just kept focusing on that.
Yes.
Is that indeed
Yes, that's an example of that. Yes,
predicting the future?
Yeah, he not only envisioned it, he actually in his own mind experienced it happening. Yeah, and for him, it already happened. And obviously 48 hours later, the Warriors were able to win the game.
Right.
Am I correct?
Absolutely.
Yeah.
A question maybe that our audience is thinking about is we spoke about all the positives of this technique and
Yes.
the incredible importance of predicting the future and
Yes.
Self-fulfilling prophecies.
Right.
Are there risks? Are there disadvantages of this? Have you found that there are disadvantages to this procedure or to this practice?
I wouldn't call it disadvantages, but I would say it ought to be practiced with caution. So working with a coach or a professional such as myself is I don't just jump to do it with everyone because they want to accomplish in their mind the best possible outcome, but also it has to be grounded in reality. So it's not just possibility, but it has to also be within the realm of probability. So for example, if somebody comes to me and says, this is a hypothetical example, the person is 58 years old and he has never gone to college. And he says to me, Dr. Torem, I heard about this technique Back from the Future. Could you please help me to practice it so I can accomplish my goal? He says, what's your goal? He says, my goal is I want to be the chief of neurosurgery at Harvard Medical School. All right? So if I were to do this with that person, that would be irresponsible. Why? Because the probability that this would happen with a 58-year-old individual that has never gone to college to get him to accomplish his dream of becoming chief of neurosurgery at Harvard are basically nil. All right? So the important element is to work with an individual in accomplishing realistic goals that have probability in them, not just, what is the word, fantasy possibility.
Right. So how much of this technique would you say is hypnotic? How much is non-hypnotic? Does this type of practice work if there's no hypnotic suggestions in what you do?
And the answer is, whether it's hypnotic or not hypnotic is not that relevant in this sense. what is important to recognize is someone doesn't have to practice hypnosis for that. Someone doesn't have to be hypnotized for that. It is more focused on that individual's ability to experience the future in such a way with all the five senses. And of course, there's an emotional element that goes with it too. Like I would use the example of a parent being there when their first child, son or daughter, are graduating from high school. And they are present in the ceremony and they're experiencing it with all the five senses: visual, auditory, sense of touch, sense of smell, sense of taste, and activating the emotions of pride and joy in that experience, and coming back from that future to the present makes it so that it is so real that for them in their mind it already happened. So their ability to experience it fully is what counts. And one of the ways I know whether it's happening or not, I have a conversation with a person. I guide them into that particular event, into the future, and I ask, what do you see? What do you hear?
Right.
All right. Let's say there is a hug after the ceremony. Experience the hug. Describe it to me. What does it feel like?
Through all the senses.
Yes, through all the senses. There's a celebratory meal after that. What is that like? What are you eating? Where are you eating? Who is around the table? What does the food smell like? Okay, what does it taste like? And so on. So they describe it in detail, and that in itself, that experience is what is internalized. And as they come back from the future to the present, they bring back with them that experience that's already in their mind and it already has happened.
You know, all of us, us included, probably daydream during the day.
Oh, yeah.
We've got a quiet environment and we're daydreaming about passing a test or a big business meeting and being prepared for, or surgery or feeling well.
Right.
Simplistically, is that kind of a form of getting through this process as well?
Yes, and I'm glad you brought it up because a lot of people do that, and guess what they do? They focus on a negative outcome.
Right, which unfortunately could be
and that becomes
human
a
nature.
self-fulfilling prophecy, and they end up with a negative outcome that they have been fantasizing about or daydreaming about.
Yeah.
So when you ask the question, is there a, quote, danger or a downside to it? And the answer is yes. If a person is generally fantasizing and daydreaming about negative outcomes through the dynamics of the self-fulfilling prophecy, they will get negative outcomes.
So, Dr. Torem, how does our audience learn more about this? I'm sure a lot of people are very interested in what they've heard so far, and we're getting close to wrapping up here. How do we learn more about this? What does the average person do?
Well, a lot of people know about the internet. They can Google it up, with my name as an author and put about articles or book chapters about a future-focused approach, okay? And I'm sure they'll be able to download some articles or book chapters and read about it that way.
Fabulous. Wonderful. It's about time to wrap up this wonderful program with a guest who's been here a number of times, Dr. Torem. We'd like to close by saying, some believe that predictions about the future are very difficult to make. However, in this program, Dr. Torem, you have showed us that when it comes to human behavior, we all may have an effect on the future outcome of the choices we make and the dynamics of self-fulfilling prophecies. And we would like to leave you with a couple of quotes. And we've all heard of Walt Disney's quote, "If you dream it, you can do it." Again, if you dream it, you can do it. And then in some of the readings that Dr. Torem has put out over the years, there's a publication, many of Dr. Torem's publication, that is guided around a quote by Dr. Abraham Maslow. And that quote is as follows: Man has his future within him, dynamically active in this present moment. The future in the present moment. We hope you enjoyed the show today. I'm Michael Neumann, host of Forum 360 with Dr. Moshe Torem, and we thank you for joining us.
Thank you, Michael.
Our
It's been a
pleasure. Thank you. We look forward to seeing you soon again.
So do I.
Thank you.
Forum 360 is brought to you by John S. and James L. Knight Foundation, the Akron Community Foundation, Hudson Community Television, the Rubber City Radio Group, Shaw Jewish Community Center of Akron, Blue Green, Electric Impulse Communications, and Forum 360 supporters.